You can start whenever you're ready.
Okay. Hi, I'm Dr. Tanisha Senthil, and today
Hi,
I'm just
Tanisha. It's good to have you back.
Hi, Dr. Mohammed. So I would just like to
Yeah.
ask the patient a few questions just to
Okay.
see what's wrong with her today. And so, can I ask those few questions?
All right. Please go ahead.
Okay. So, can you tell me the patient's name and age once more?
All right. Shekaranta nawa ne kuma me sunanta? So her name is Khadija, and she's 6 years old.
Okay.
Yeah.
What's her aunt's name?
So ke me sunanki? Is Sa'adatu. Her name is
Saad.
Sa'adatu. Yeah.
Saad. Okay. So is Khadija going to school?
So tana zuwa makaranta. All right. She said Khadija here is going to school. She is in nursery too.
Okay. Can
Yeah.
you ask how school's going for her right now?
So yeah, makarantar yanzu. Okay. Amma kafin nan tana kokari a makaranta. All right. She said currently Khadija does not go to school because of the COVID-19 pandemic, but before then, she's doing well in school.
Awesome, that's great. So tell me a little bit about the family. So does she have any siblings?
Hello, Tanisha.
Hello,
Hello.
I'm there. Hello? Hello, can you hear me now?
I can hear you, Tanisha. Please go ahead.
Okay. Um, so can you tell me a little bit about her family? Does she have any siblings?
Okay. So tana da 'yan uwa ne? Kuma yaya yanayin gidansu yake? Kaman su nawa ne a wajen mamanta da sauransu? Okay. All right. She said Khadija here, she is the eldest daughter of uh, the mother's three children. So she has two siblings who are males.
Okay, awesome. So tell me a little bit about what her parents do and what her aunts do, what her aunt does for their jobs.
All right. So iyayenta me suke yi? Aikin me suke yi? Mamanta da babanta? Ke kuma aikin me kike yi ke ma? Okay. All right. So ke fa? Ke antinta ke kuma aikin me kike yi? Tana so ta sani. Okay. So she said Khadija here has her mother is not gainfully employed. The father is a civil servant, and her aunt here, Saada too, she just finished high school. So
Oh,
she's not employed also.
okay, okay. How was high school
Yeah.
for Saadatu?
So tana tambayin ki yaya makarantar akwai daɗi ne da kika gama yaya makarantar naki? All right, she said she has finished and it was good and she really enjoyed it.
That's awesome. That's
Yeah,
great.
yeah,
Um,
yeah.
so I would like to hear a little bit about her living conditions. So does she live in more of a city area or more of a rural area?
All right, so kuna zama a cikin gari ne nan? Okay, so ya yanayin gidan da take da kuma anguwan da take ya yanayin anguwan da gidan. Okay, so babu irin su ko cunkoso ko wani su kwatami su ciyayi su wani ƙazanta da sauransu a gidan. All right, so she said they live in the town, uptown, and yeah, so they have a very good living condition. So they have a hygienic, their home is hygienic, and the surrounding during this rainy season, they used to have some bushes around.
Awesome. So
Yeah.
from my understanding, do they have like access to clean water and uncontaminated food?
So kuna samun ruwan famfo ne kuna ko kuma wani irin ruwa kuke amfani da shi? All right. All right. That they use is well water.
Hmm.
at home. Yeah.
Okay. So how has she been eating lately? Has she ate 3 meals a day and healthy foods?
Ya tana cin abinci ne kamar misali tana samun abinci kamar sau uku a rana kuma wani irin abinci ne yawanci take samu. Okay. Sai kuma wani irin abinci ne yawanci take ci a gida. All right. She said she takes 3 square meals and predominantly carbohydrates.
Okay.
Yeah.
Okay, that's great. So may I ask what exactly brought her in today?
Okay. To me ne wai sa ka ta asibiti me yake damunta? Me yake damunta? Mm-hmm. Okay. All right. That she has fever,
Mhm.
general body weakness, and easy fatigue, and she also have shortness of breath.
Okay. I'm a little concerned about the fever, so can you ask them a little bit more about the fever? Does it come and go, or is it getting progressively worse over time?
Okay, so zazzabin nata nan yana zuwa ya tafi ne ko kuma yana karuwa ne ko yana dan raguwa kafin ku zo asibiti? Okay, okay, all right. That the fever comes and go, and it has been increasing. So that is what prompted them to come to the hospital.
Okay. So
Yeah.
it comes and goes, but it has been increasing over time
Yes, increasing
as
in
it comes in.
severity. Yeah.
Okay. Okay, got it. So is she experiencing any loss of appetite recently after
Okay.
the symptoms started?
Da ta fara shi lafiyar nan cin abincin ta ya ɗan ragu ne? All right, that she has. Okay, she's been having loss of appetite since the beginning of the symptoms.
Okay, okay, got it. Is
Yeah.
she experiencing any leg swelling?
Okay, akwai kumburin kafa ne? Tana fama da kumburin kafa? Okay. Okay, so she doesn't have any leg swellings.
Okay. So I want to hear a little bit more about the shortness of breath as well. Is it hard for her to inhale? Is it a nose blockage? Or is it just hard for her to breathe through her mouth and her nose?
Okay, so akwai so idan tana da samun irin hancinta yana toshewa ne hakan nan? Okay, sai me kuma? In ta ɗan yi aiki, in ta ɗan yi ko tafiya ko wani abu numfashinta yana ɗan sama-sama, in ta ɗan yi aiki hakan nan ko ta ɗan yi tafiya? Okay. All right. So she said the shortness of breath is usually during activity, and there is no nasal blockage, no cough, no other respiratory symptoms.
Okay. Okay, got it. So also, is she experiencing paleness of the skin or the eyes by any chance? Can you please
All right.
examine that
Um,
for me?
yes, she is pale. You can see the palms here. She's pale. You can see the sclera is also pale, even though yeah. So she's pale.
She's a little pale. Okay. Has she been experiencing any cough?
Yeah. Tana tari ne sosai. All right. That she's not been coughing.
Okay. So before you mentioned that she was feeling a little weak. So has she been also feeling a little pain with that weakness?
Okay, tana jin ciwo ne a jikinta. Tana complain in tana jin ciwo. All right. So she also having pains. She used to complain of pains in the body, joint
Okay.
pains. Yeah.
Okay. Um, so I am suspecting malaria and nutritional anemia. So I would like to run a rapid diagnostic test, a blood
Okay.
film, and I would like to also run a full blood count.
Okay. So for the full blood count, her hemoglobin level is 6.9 gram per DL. For the RDT, rapid diagnostic test for malaria, is 2 plus, shows 2 pluses of malaria.
Mhm.
And blood culture also yielded positive presence of Salmonella typhi.
Okay, okay. I was also suspecting typhoid fever as well. Thank you so much for clearing that up. Um,
All right.
so for her typhoid fever, I'm diagnosing her with typhoid fever, um, a severe case of malaria, and a severe case of anemia today.
Okay, that's good.
Um,
That's good.
so for her case of typhoid fever, I would like to give her antipyretics for her fever, and definitely drinking an adequate amount of water and having adequate nutrition is really important for that. And antibiotics for the bacterial infection, the salmonella bacterial infection. Um, so
Okay.
one, uh, so one antibiotic that I recommend is amoxicillin.
Okay.
And for the malaria, since it is a little bit more complicated because of the anemia, I'm recommending an IV artesunate for the treatment. And for the
Okay.
nutritional anemia, it is severe. So I want her to do a blood transfusion just to get the iron back into her system. So for more
Okay.
preventative methods in the future, I would like her to be more hygienic. So washing their hands more frequently and using hand sanitizer if they have access to it more frequently. And for the malaria, to prevent less mosquito bites, I recommend that she wears long sleeve clothes, long pants, and if she has access to mosquito repellent, I recommend that she uses that. And sleeping with mosquito nets to avoid mosquitoes biting her while she's sleeping. And lastly, for the nutritional anemia, I recommend that she takes iron supplements, vitamin supplements to get those nutrients back into her system. And for the dietary modifications, I know that she's experiencing a loss of appetite recently because of the fever. So I recommend that she definitely eats more leafy greens and eats more proteins to get that iron back into her system since she does have a severe case of anemia.
That's perfect, Tanisha. You have done well. Um, from the history, you were able to suspect that this patient is having malaria, typhoid, and anemia, and you ordered the investigations to confirm, which the RDT confirmed your malaria. The blood counts also confirmed that this patient is severely anemic, and also the blood culture also confirms your diagnosis of typhoid. And you did very well by stating the correct treatment for this patient. For complicated malaria, you used IV artesunate. And for the anemia, blood transfusion, you can see this patient is already on blood transfusion. So
Awesome.
that's correct. Yeah. So the for the typhoid, also IV antibiotics, specifically mentioned amoxicillin, which is very good. So you're also able to state the future prevention for both malaria, anemia, typhoid, which were all very correct. You have done very well, Tanisha.
Thank you so much,
Congratulations.
Dr. Mohammed. Thank you
You're
so much. I
welcome.
really hope Khadija feels better soon and she gets the treatment that she's needing, as she already is. So please convey my message to her.
Alright, ta ce wai tana muku godiya kuma tana fatan yarinyar ta samu sauki. So they are also saying they are very grateful for what all you have done to them, and they are happy.
Of course. Thank you so much.
So congratulations once more, Tanisha.
Thank you so much, Dr. Mohammed.
Yeah.